Okay, our presentation is the prevention of HIV/AIDS for adolescents and early adults. HIV and or AIDS stands for Human Immunodeficiency Virus and Acquired Immunodeficiency Syndrome. It's a blood disorder and has many myths and false truths surrounding it. It's pretty rare, fewer than 200,000 cases per year. Transmission consists through semen, vaginal fluids, breast milk, and blood. And these are usually through anal or vaginal sex with someone who has HIV or sharing needles and syringes with anyone in general. Those who are at the greatest risk of getting HIV or AIDS are those who are gay, bisexual, and any other men who have sex with men are at a greater risk to just have the infection. The symptoms can vary greatly for anyone. You may have flu-like symptoms after weeks, or some may not experience symptoms for months. It just depends on each person, I suppose. And the diagnosis and testing, you will not know that you have HIV for sure unless you get tested, and that is through a nucleic acid test or an antigen antibody test, and I'll talk about that more later on. And there are some pictures posted so you can see what it looks like, and then some common prevention things like using condoms or PrEP, a pill, which we'll also talk about later, and then testing and treatment.
Pathophysiology of the disease process for HIV. There are 5 bodily fluids that HIV can be transmitted through. This includes blood, semen, rectal fluid, vaginal fluid, and breast milk. There are 3 main ways that HIV is passed from a person to person, which is during unprotected sex, sharing of needles, and during birth. HIV attacks a person's immune system, specifically targeting lymphocytes, which HIV then destroys them, and it destroys them so quickly that our body cannot replace these lymphocytes fast enough. And after a long period of time, with this occurring, a person's immune system will be weakened, and it is harder to fight off diseases and infections. It's possible to have HIV without experiencing these symptoms at first. If you would experience symptoms, they're going to be flu-like. These include, but are not limited to, swollen glands, skin rashes, vomiting, nausea. The symptoms will eventually subside without treatment, and then after several years or a prolonged time, the immune system will have weakened enough that new and worse symptoms will appear. People are going to be more susceptible to common infections and opportunistic infections. The second set of symptoms that people with HIV encounter is the virus turning into AIDS. And if treatments are missed or not taken properly, this allows HIV to grow stronger, which then in turn makes it harder to treat.
Here we will look at the state and U.S. demographics for HIV. With HIV, there are many ways that it can be passed from one person to another. For instance, HIV can be transferred from person to person through sexual intercourse, tainted needles, and from the mother to child during birth. Certain demographics are at most risk for contracting HIV. For instance, men have the highest chance of contracting HIV. This is because of the way HIV is most commonly transmitted, through anal sex. Therefore, gay or bisexual men have sex with other men who are having sex with other men are at the highest risk for contracting HIV. Almost 82% of all cases from HIV are found in men, while only 18% are found in women. Of the 82% found in men, almost 70% of these cases were linked to gay or bisexual men. Heterosexual contact of HIV contributed to 24% of all cases. 6% of all cases were related to injection drug use, and less than 1% of all HIV-related cases were linked with the mother to child during birth. Race also plays a role in the frequency of infections. For instance, the African American population accounts for 39% of all HIV-positive tests. because there's a lot less African Americans in the U.S., only 13% of America is made up of African Americans. This is crazy if they're coming up with almost 40% of all HIV positive cases. Because of this, we also see a lot of African American heterosexual women and men contracting HIV because of the partners they usually choose. Mainly African American men choose African American women. Overall, HIV has stayed stable since 2014 after having a steady increase almost every year prior to that.
Primary prevention for HIV. There are several ways for primary preventions. One is having an educational background on HIV, which this would include prevention programs for people that are at a higher risk of contracting HIV. For some people, the higher risk factors are due to their preference of sexual partners, their risk behaviors, and where they live. Practicing safe sex is a primary prevention. Safe sex includes properly using condoms at all times or practice abstinence. Also, practicing safe drug use, such as don't sharing needles, use your own, make sure they're sterile, or just the simple fact of don't do drugs. Another primary prevention includes STI screening and treatments. Sexual transmitted infections increases a person's chances of getting HIV. If STIs are treated, then this will help reduce the risk of getting HIV. And then there are a couple pills that you can take to help in the prevention. So the first one is PrEP. It's pre-exposure to prophylaxis. It's a pill that you would take daily and it helps protect you from HIV. And then another pill is PEP, post-exposure prophylaxis. It's an emergency pill that you take if you think you've been exposed to HIV or if you know you have been exposed. PEP can stop the HIV before it starts to infect your body if taken soon enough.
Okay, next we have secondary prevention, and I know we said PEP was primary, but it's definitely secondary. It's post-exposure prophylaxis, which basically just means post-exposure is after you might have been exposed to it. It's just a series of taking antiretroviral medicines, also known as like ART, after being potentially exposed. You're still taking these as if you do not know that you're infected yet. It's just an extra step to prevent becoming infected. And they should only be used in emergency situations. And they must be started within 72 hours after a recent possible exposure. And emergency room doctors can also prescribe this. Another prevention is any types of screening, so STI screenings and treatment. Basically just getting tested for any other STDs or STIs like syphilis, hepatitis B, hepatitis C, chlamydia, gonorrhea. Just taking care of those is definitely a big step towards preventing HIV. And then needle exchange programs are a part of secondary prevention, specifically just because I think it's practice called harm reduction, specifically for people who are already practicing drug users. So using sterile needles is one thing. For somebody probably practicing primary prevention like a diabetic, using sterile needles is a safe way, but drug users who are using them quite often and perhaps not safely, it's always good to go to a needle exchange program and get safe supplies and just learn about what you're doing. And then lastly, our test specifically for testing for HIV and AIDS, which is the nucleic acid test. This test will show results 10 to 33 days after exposure, so you'll know if you're infected 10 to 33 days after exposure by taking this test, whereas the antigen antibody test could be anywhere up to 18 to 45 days after, and then specifically just the antibody test could take up to 23 to 90 days after. But those are just the window are most reliable. They're not a very narrow. Some of them can be pretty broad, but um, they all work either way, whichever one you probably prefer. But I would probably go with the nucleic acid test simply just because, I mean, if you're going for the closest, most recent exposure, whereas maybe months later you're starting to feel the symptoms, since symptoms can vary greatly than the antibody test. But those are just a few of the ways of secondary prevention.
Here we will look at the tertiary prevention of HIV. Once a person is diagnosed with HIV, they would like to know what their options are. Right now, there is not a cure for HIV, however, there are many options in order to treat it. The most common way for men and women to be treated for HIV is through antiretroviral therapy. Antiretroviral therapy, or ART, has three specific goals. One is creating resistance to the individual HIV strain. Two is to stop the strain of HIV from mutating and creating a new strain. And three is to repress the HIV found in the blood. There are many classes of drugs that aid to these three goals, but I'm going to talk about a few of them. NNRTIs, or non-nucleoside reverse transcriptase inhibitors, shut down a protein that helps HIV translate. NRTIs, nucleotide reverse transcriptase inhibitors, block the HIV from attaching to the proteins needed to make copies of HIV. Protease inhibitors suppress the protein HIV protease. This is another protein used by HIV to make copies of itself in the body. Integrase inhibitors shut down the protein integrase, which HIV uses to attach to CD4 T cells. CD4 T cells are most commonly destroyed when HIV enters the body. Finally, fusion inhibitors block HIV from attaching to CD4. As you have heard, HIV is a blood disorder that can be transmitted through needles, semen and vaginal fluid, and blood. It affects mostly gay and bisexual men and is found to attack the African community greatly over every other ethnicity. Taking proper precautions like wearing a condom during sex, getting tested for HIV, and using clean needles will help stop the spread of HIV. Different tests and screenings that are done, like nucleic acid tests and the antigen antibody test, can help detect for HIV. Therapies that help prevent the spread of HIV and slow down the spread of HIV once it is in the body include pre-exposure prophylaxis, post-exposure prophylaxis, and antiretroviral therapy. Understanding what HIV is, knowing how to prevent it, and once it is contracted, slowing down the effects of the virus is vital in fighting this disease.